as a woman, it's like, then you're not a strong woman. You can't handle this pain.
Yeah.
We don't have to normalize being in pain. If you're in pain, you're in pain. I mean, men get man flu all the time, and we give them the sympathy. I know it's not the same, but we really need to normalize the conversation around pain.
Everyone, and welcome back to another episode of Teenagers and Periods. So we've all had, whether it's like in a biology class or in science or from a simple Google search, what a normal period should look like. So you should have a cycle for 28 days and then your average period is for 3 to 5 days. But then that's not usually the case for everyone. Personally, I've had the privilege, which I don't take for granted, of having what you'd call a textbook period. But then it came to my attention that, not everyone has the same type of experience. So for this episode, we're joined by an amazing panel of fantastic women who are doing amazing things in their individual fields. But today they're going to be sharing with us the different menstruating experiences that they've had since they started menstruating. So we are joined by Njeri Mokira, who is a digital marketer. We have Lynna Owiti, who's an entrepreneur. We have Tamara Nerima, who is a marketer. And finally, we have Elsie Wandera, who wears many hats, but she's passionate about purpose, and she's also the founder of Endometriosis Foundation of Kenya. So that's why she's in all yellow today. Okay, and we'd just like to, before we even start the panel, we'd just like to give a disclaimer that none of us are medical professionals, and every experience, or experts, and everyone's experience is unique to them. So even if you have similar symptoms of what they've had, don't self-diagnose. It's advisable to go and see a gynecologist or a medical professional in order to get a proper diagnosis to address your situation. So before we even delve into the conversation, I want you to describe your first time in just one word. We'll start with you, Tamara. If you had one word to describe your first time.
Embarrassing.
Okay, we'll come back. We'll come and unpack that a little bit. Lynna?
Awkward.
Okay.
Concerning?
Okay.
I think for me was anxious.
Yeah, I would fall in the same category as you. So I went to an all-girls school for primary year. Everyone had started. And then people would say like, oh, I'm having cramps. Oh, I need to go and change my pad. But me, I'm not having this experience. I'm like, excuse me, I'm waiting for you to come here. But you see, we all have different experiences. So like yours was embarrassing. So would you mind just, if you're comfortable, expounding on it a little bit?
I was the youngest person in my class and also the first to have my period. I just was like, this attention, I don't want it. And then back in the day, there was the mkate. That was like literally a loaf of bread. So you have your school uniform that has pockets this size, and then you have this loaf of bread that you have to carry around. So then there was how you're going to change in the loo. So it meant I used to put it in my uniform, in my bra here, so that no one can see where I'm carrying it, where I'm putting it. So there's always also that embarrassment of I have a pad, and then back then, I don't think they were also individually packaged. They packaged. So you'd have to pull out that kawan buffalo of yours and then either fold it in your pocket or just. So that's why for me it was quite embarrassing.
Why would you say yours was awkward?
I was young. I was in like class 4, I think. I was very young. No one had ever talked to me about it. So I was home and I was with my dad. So when you go to the washroom, I was like, the only person I could tell was, my dad. So, I want to tell him, blood is coming out from down there. And he was very happy. He was like, oh, wow. And I'm like, what's going on? What's going on? But yeah, he called the household to help me. And that was that. But then I was like, just with your dad, it's like, it's awkward.
Yeah, because usually something awkward. But at least you had someone who was excited for you, so it also made the experience a bit easier.
He didn't say why he was excited. When someone is excited, you're like, what's going on?
You're like, where blood is not supposed to come from down there? Why is it coming from down there? So, Njeri, why would you say yours was concerning?
So I am the heart of Njeri in Mathai. I'm with my grandmother. My mom has gone somewhere else. Then I feel like a sharp pain and I'm very uncomfortable. When I stand up, I'm actually dizzy, so I sit again. So first I go to the washroom, like eventually I realize I'm having my period. By the time I'm walking to my bed, I faint. So my grandmother finds me, and now it's, you know, grandmother. And like I'm named after her, so she's like, oh, my namesake. She starts calling, you know, the house girl wants to call my mom, find out what's going on, and best believe for the rest of the day I was fed a lot. I had from arrowroots to bread to porridge to soup, everything possible, because she was like, oh, yeah, my grandchild. So it was, my mom came and she was okay, but considering it was my grandmother, so seeing her reaction, when I was like, oh, yeah, okay.
It's a bad thing.
I thought it's normal, I've been waiting for it. Why is it so concerning? But I didn't know that also the whole fainting, all that drama that came with it is not what I expected. I thought it would just be my period has come, I'm a woman.
Okay. Yeah. So as you and I had the both, you know, like anxiety. So would you just speak a bit on why yours was anxious?
Yeah, I think like everyone, I think I expected my period and I was really looking forward to it. I think, you know, the always pads, as you know, as interesting as they looked at the time. And I remember I was in the shower and I was bathing, and then of course I just started seeing, you know, that like there's some discoloration of the water as I'm washing, like there's something interesting going on. So I started screaming. I remember I cried in the bathroom for a while. And then, you know, of course, my mom comes to pick me up in the bathroom. She's like, what's going on? I'm like, I'm dying. By then, I really was dying. Then she's like, no, it's your period. And yeah, so that was a little bit, I don't think you're ever ready for like it. For the visual,
actual,
the experience, the blood and everything. I don't think there's any young girl who is ever ready.
Okay, so your period is here, you know, your cycle, you're menstruating, and then something happens. It's not the same like what you read in the textbook. It's not what, you know, your friend told you, this is how my period is. Because for me, in school, I never had cramps. But I would see people going to the infirmary, so I'm like, well, you know, are you just going to sleep? Or like, you know, what's actually going on? And then one of the things that teachers did is that, and I guess also society does that we can talk about later, is that we sort of negate someone's pain. So like a classmate would go and say, I'm in pain. You can go and see them like really, you know, bending, but the teacher is like, no, just sit down. So when would you say that you noticed that something was a bit off with your cycle? Like at what point?
I think mine was maybe a year after my first period, because then I was constantly in pain when I was in my period. And I remember initially I used to think maybe I'm sympathizing with my mom because she had really bad cramps as well. But those days I couldn't even walk to get out of bed. And then the heaviness of the period. You know, you're told, oh, you know, you change your pad maybe 3-4 times a day. I was changing my pad like 5-6 times a day. And then the pain. And then I wasn't taking Panadol. I was taking a painkiller called Betapin. And I was 12, 13 at the time. 12, at the time. So I was taking half a Betapin, and if you know how strong Betapin is, it meant that now at school, the teachers are like, why are you sleeping in class? And I'm like, guys, I've taken a painkiller, I'm in pain. And then at home, it meant that when I take it, I'm out. My day is done. So that, for me, was not normal. Everyone else was like, oh, I have a Panadol, I'll take a Panadol. Life goes on. Meanwhile, some of us are just dying and taking these really strong painkillers.
Lynna, what would you say was yours?
When they came, like I started noticing they were heavy. So I genuinely started to dislike them, you know, so because it's like, this is stress. So every time it was irregular, I never paid attention to it because I was like, they're not coming. It's fine, we move, you know, because they're not coming. So they were constantly very irregular, but then I really never cared because I was like, I don't have to deal with them, that's fine, they'll come when they come. So in uni now, that's when it started becoming irregular, and then, you know, just its own dramatics. It was just now it started doing the most, you know. I was like, okay, now I need to, there's something genuinely, very wrong.
I think for me, it was also the same thing. At first they were irregular, but then even textbook-wise, we had read that there was something like an irregular period, and because mine started late, so I had also heard about other people. I think that was in Form 1. So sometimes I'd go 3 months and I haven't had my period. I didn't know that that's actually not
right.
normal. So I think at some point it got to beginning of Form 2, and then when they'd come, they were extremely heavy. And I'm in a girls' public boarding school. So even it got so bad, I'd carry sufficient pads when going to school, but they'd So I have to send now the secretary, please call my mom to bring more. It got to a point my mom had to start bringing for me like in a carton.
Like a box.
And at night, I'd have to double pad. So I'd take, the always night pad that's already very long. I'd have to use 2 of those at night and I'd still change. So that 5-6 times changing is the one. The pain was so bad. I'm in the middle of class. I'm put for a raincoat at the back of the class to sit down just so that cold can, the concrete floor can then I went home, and at some point I was in the toilet, I'm changing. My mom is like, are you pooping? Like, you've been in the toilet for a while. I'm like, no, it was blood clots. So usually it's normal and they can be small and they'll just come out, but these ones are so big, I had to like sit and hold myself and wait for it to just come out because it was uncomfortable. I couldn't walk, I couldn't sit. So I took too long in the washroom, and she came and she was like, are those clothes? Yeah, tomorrow gynecologist. And that's when my relationship with the gyne started. That was in Form 2.
Wow.
Yeah.
Wow. Yeah. That's so, I'm so sorry. That's heavy.
Yeah.
Yeah, so I was also in high school, so I used to have very irregular periods. I started with very irregular periods. Of course, because like I think when we're young, and again, I think those are conversations that are necessary to be told that even as they come, they'll not be smack on like every month. It'll take some time before they regularize. And I think when I was going through that, I think for me the manifestation of pain now began. So I used to have to go for a jab from school. Like I had to pick up, or I would have to go home and go to the nearest health facility and then get an injection. So for a very long time, I think up until I was, 26, that's when I said, okay, ridiculous, this cannot be my life. Like, me, none of those painkillers were working. I remember even my mom had the conversation with me finally. She was like, yeah, it's been in our family. And I'm like, but
why didn't we?
It's been. Why did you? But yes, I was told that, I couldn't give birth, but here you guys are. And I'm like, but I've told me, like, let's have the conversation. She's like, yeah, I'm sorry. Then, of course, then I remember even my aunt talking to me about it, about how even my cousin had to also go through, like, a similar kind of experience before she was diagnosed. And I think that's when I first went in, like, for me, for endometriosis to be diagnosed, you have to go through a laparoscopy for them to definitively diagnose that yes, it was endometriosis.
Yeah, I think everything that you guys are pointing out is that one, it started with irregular periods and then heavy flow and then pain. But I think we also need to normalize the conversations, but also what is normal. So I think when you just feel like something is off, like instead of assuming, because you thought 3 months was normal, but apparently 3 months is not normal. So I think also just for everyone watching, if you have a question, just go and ask. Like if you say, mine, today they came, next month they didn't come, if you feel like that's not normal, I think just address it with a gynecologist so you can be able to detect something earlier.
It's better to be told, no, it's okay.
Yeah.
Don't worry. Than just letting it stay and then it gets out of hand.
Yeah, that's true.
How you're saying it's better to ask me. Most people start in that place for like not uni, high school. So like these high schools, the people who are there, the nurses, because I'm thinking in the high school I went and told my nurse, it didn't come, she'd be like, okay, so then why, what's going on, then why are you here? It needs to be like a more serious.
It has to be like a more serious thing for you to. So I think even nurses and people in schools need to empathize. One of the things that I would suggest is there's a hotline called Anti-Jane, so it's toll-free. We'll share with you the toll-free number, and you can always call them at any time and ask them because they have gynecologists, any questions pertaining to your cycle. Like if you're not comfortable going to a nurse or seeing someone in person, that's also an avenue that you can use. So I think none of you have, apart from Elsie has mentioned the condition that she has, so would you tell us a bit more about your condition?
Mine is called Adenomyosis. It's Endometriosis' less known sister. And I discovered I had it a year ago. But prior to that, I was diagnosed with fibroids when I was about 21. So all through high school, into uni, still had the heavy periods and the painful cramps. And it got to a point where nothing over the counter was working. Betapin at some point stopped working, and for me that was a red flag. So I was living in the UK at that time, so I went to see my GP. And he says, oh, try another painkiller. I said, no, I'm tired. He said, we can give you a morphine one. I said, you can't keep treating pain if I've had it for this long. So then he referred me to a gyna. Then I went for an ultrasound, and then they found fibroids. And they found small ones, and this was, when was I 21? Some years ago. Anyway, at that point, he said they were negligible. So all it was pain management. So I was put on different painkillers. Then I moved back to Kenya a few years later, and now my cramps were much worse. And then my stomach was constantly bloated, and it almost felt like I was almost always in pain or discomfort. And then the nature of the pain of my periods changed, because aside from being the pain in the uterus, there's another pain that actually extends into your back and into your anus. So you can't sit, going to the toilet is difficult. So it got there, then I went to see a gyna here in Kenya, and he told me, you have fibroids inside and outside of your uterus. We need to take them out. So then I had my first surgery to remove my fibroids. That was 10 years ago. So they removed them. And the thing about fibroids is that they never remove all of them. There's always the small ones that they can't quite cut out. So he said, you do have the smaller ones, but we can't remove them. So we're just going to have to manage and monitor your condition. So that was how now the whole journey started. Then now, last year, the year before last actually, I went through a period where I got really bad back pain. Now I've always had back pain that is kind of associated with the fibroids, but it was terrible. I was down for, I think it was a whole week, bed rest, could not walk, and I was on painkillers. I went to see the doctor again, and he says, okay, your uterus is enlarged. So the fibroids weren't growing, but the uterus was now getting enlarged. After about a month or so of medication, my condition was managed. I could go back to work, I could walk and everything. And sometimes I really hate dealing with the healthcare system here. So I was like, okay, if he's treated it and it's fine, we move. Then now last year, I got another attack with my back where I couldn't move. My cramps were literally killing me, and I felt like I was overdosing on painkillers, because then I was constantly taking painkillers. My flow was heavy. So then he says, okay, you're going to go for an ultrasound. There's one where they put the thing inside. There, yeah. I went for that, for a regular one, and then they did a pelvic scan. And it was while I was looking at the results for my ultrasound that the radiologist told me, you have adenomyosis. I was like, He's like, you see this uterus lining of yours? It's eating into the muscle on the inside of the uterus. So I was like, oh, he's like, yes. And what happens is, your uterus will enlarge because of that action of your lining going into the muscle. It's just a whole science around it. So I went to see my gyna again, and he says, okay, this is definitely what you have, but unfortunately, it's not a curable condition. It's something that for most women, once you get into the age of menopause, it disappears. But I also have a history of fibroids. So then there's also the issue of your childbearing age and how this is going to affect your ability to have kids because you have adenomyosis. And right now I'm at the stage where we're just managing the condition. Unfortunately, in our society, there's also pressure to have children when you have either fibroids, any kind of uterine condition. You're told have children. I'm like, that can't be the cure.
That's your story.
Yeah.
But just to define for everyone watching what adenomyosis is, is it occurs when the tissue, like as Tamara said, that normally lines the uterus, so your endometrial tissue, grows into the muscular wall of the uterus. So the displaced tissue continues to act normally, but then it thickens and breaking down, and bleeding during each menstrual cycle. So that's why you still have your periods. An enlarged uterus and painful and heavy periods can result. But usually also something else I was reading is that it's hard to diagnose because like 1 out of 3 women don't have they don't show the symptoms. Like and then it's also very expensive. Like you said, the only way you are able to say is like, if you do a pelvic scan or ultrasound, which not everyone can afford. So it's also something difficult to diagnose. So Lynna, would you mind sharing with us a little bit about your condition?
So I have PCOS. I was diagnosed late 2019, and how I came to know was I had spotted for 3 weeks constantly, then they stopped. Then 1 to 2 days later after spotting, I got the heaviest period of my life. I had never seen anything like that. Honestly, I was like, what is, where you have to you put on a tampon, after like 30 minutes, you feel like it's already starting to come out. And then when you go to the bathroom, whatever, the clots are, now that the clots, the real clots. So I was like, okay. The period itself was also taking time. It was taking time to end. So I was like, okay, fine. I need to see someone. I need to see a guy now. That time, people who were my age at the time, everybody has a pretty much, regular period. No one is seeing gynas, no one is doing so. When I looked for a gyna, I just went, there was someone who had done a Twitter thread for best gynas. I went, I looked at, the one who was written most recommended. And I went, I googled him, I saw, okay, then that's the one I went to. So I explained to him what was going on. So he was like, okay, you just have to go get an ultrasound down. So I went to get the ultrasound. So they did the normal one. The ultrasound guy was like, oh, I can't see anything. So now he did the other one. Which was one of the worst things I'd ever experienced also. So he did it. Then, so he was like, hey. So that guy was like, hey, Hapa. Naona. He was like, Naona, sis. And me, that time I'm like, so what are you saying? He was just like, oh, tell the two upstairs, as I could explain, So, the guy that told me he'll put me on birth control to help regularize the periods, and that was that. So, but me now, I'm born in school of YouTube, school of Instagram. I'm born those schools. So I went home because I was like, okay, he's told me, but I don't understand why the A is like why I have to go on the pill or whatever, which I did. But then now the pill ended up affecting my mental well-being. I hated it. So I got on school of YouTube and all the ladies there, I became their student and they, taught me how to quote unquote manage it. I'm still in the process, but eventually I just ended up getting off the pill because it wasn't doing really well. So that's where we are right now.
So just to define what Polycystic Ovarian Syndrome is that it's a condition that affects a woman's hormonal levels. So women with PCOS may have infrequent or prolonged menstrual periods or excess male hormones. So like the androgen levels are higher than normal. And the ovaries may develop numerous small collections of fluids, so follicles or cysts, and fail to regularly release eggs. But I think even the way you said that, it wasn't really adding up. Like I have cysts, so you're putting me on birth control. Like I think also something that even doctors need to do more is just explain, like teach me so that I know, like this is the thing I'm dealing with. And at least School of YouTube helped.
I remember having the conversation with Njeri, and I was telling her I'm getting off this pill. Don't want to be on it. And Njeri, how she was telling me, the pill helps. I was like, I don't want to hear it. I'm out.
Because the pill is different for everyone. It might work for someone. For me, I just feel like maybe, I'm moody, I'm angry, like I just don't like myself when I'm on it. So it's also usually important to put yourself first. Njeri, would you like to tell us about your condition?
God, I feel like mine is the baby of babies. Mine is hormonal imbalance. So simple as it is. The problem was, So like, okay, I had ridiculously long periods. They were irregular, and then there was a time where I had a period for 3 weeks, rested for 10 days, then it was back. So of course by that point, and then they're getting dizzy. So from science and biology and whatnot, I figured I was a bit anemic because I'd get very pale during the time when I'm bleeding. So now when I went home is now when I went to see the gyna. The first gyna I went to, of course, because I'm very young, I think I was 15. So my mom was like, I want you to see a lady gyna, of course, naturally, because you're very young. And we got there and she was so insensitive. She was so like, oh yeah, I know you're young, but if you continue like this, you might not be able to have kids. So we'll put you on Femi plan.
Wow.
My mom almost fainted first in that room. I'm about to cry because I'm like, I love children personally. So you're telling me at the age of 15 that I won't have children and you're not explaining it. My mom just ended the session there. She was like, you know what, get out. I was like, okay, get out, then let's go. So like 2 days later is now when I went to see the current gyna who I'm still seeing to date, and is someone who's really helped the family. And that's when he explained that my body does not naturally produce enough levels of progesterone. So I guess that's why I was not getting my period for such a long period of time. But see, also my uterine wall is becoming extremely thick. So to shed it is going to take a really long time. And then also the pain was ridiculous at that point. So I had to go on the pill for that reason. So you see, for me, the pill, honestly, I think I was so young and naive. I didn't even know that that's the same pill that's still birth control. Might just know I'd been put on dawa. So now I think later is when I was thinking, I was like, wait, that's the same pill that guys actually take for birth control. It's just that I had to start on it very young, but also for a very short period of time. So the first pill I took was, I put on so much weight. Then I'd get breakouts, which I still do to date, but it was like extreme. So we had to change. I had to change it. I took it for a couple of months and it stopped. My period, it took time, but it started to regularize. So it went slowly to 10 days, 8 days, until now where it's at. It's still at 6-7 days, but from where it's come from, I'm fine, honestly. I'm not complaining. I'll take the 6 days and run with it. But at least now it comes every month. It's regular. The clotting went down. The clotting is now the normal one. It's not the one where I can't, like I have to pause until it gets out. It's not the crippling one. But yeah. The mood swings are on and off. I think it's something that now you just have to manage. It's not, I was told that's not something that would be able to cure immediately, but what I'm happy about that's my gyna and the pill also helped is now I'm ovulating. Because you know, if you're not ovulating, then it is true what the first gyna said, you may not be able to have children. So at least that part of my womanhood is back to normal.
Thank you for sharing. So basically what hormonal imbalance would be defined as is that, so it occurs when there's too much or too little of one hormone in your bloodstream. So in relation to the menstrual cycle, so we've, you know, there's follicle stimulating, luteinizing, progesterone, estrogen, all those things. So if like there's even the slightest hormonal imbalance, then it not only affects your period, but your entire body as well. And that's why you're saying like you are nauseous and you are dizzy and all that. Elsie, would you like to share with us a little bit about your condition?
Yeah, so it's interesting. The people in theatre called me the frequent flyer because I've had 4 surgeries just for endometriosis, and just because it has no cure, like adenomyosis. It has no known cure, no known cause. So I remember having my first surgery, and the first surgery was to, of course, remove, there was a chocolate cyst that was almost about to burst, so they caught it in good time. And I remember, like, you know, like all of you are being told that, you know, the threat of you will never conceive, you will never have children. So I remember, like, this was the first diagnosis. I mean, this was the time when I was being diagnosed with endometriosis, and I remember I was dating then, and I was seeing this guy, and I was telling him, like, we must have babies now, and we're 26, please.
Wow.
Not, we're not even married, but just out of, it's from a place of fear. So it's not, I was responding from a place of fear rather than, am I actually ready for it? Is something I'm actually willing to do? And so yeah, I mean, it was quite unfortunate. And I remember that the easiest way the gynecologist could describe what was going on for me was that my uterus was growing inside out. I was like, that's so cool.
Yeah.
So I went around telling people, oh, my uterus is growing inside out. So I have a special condition. I mean, just so that people could also get off my back that thing of, you know, it seemed like I was feigning illness. Like, you know, what kind of woman are you? You know, women actually go through period pain.
Yeah,
so who are you?
you're supposed to
different.
manage it.
Exactly. You know, suck it up and actually keep going. And I remember that was part of the reason why I just had so much passion. I remember when I was going in for my second surgery, I could not understand that there was no doctor who had an answer for me in terms of, so how do we fix this? Without even realizing that, yes, the condition is complex, and how it manifests also is very complex from one person, from another woman. It's very complex. You know, the birth controls for me were like a no. I was like, no, I'm not going to go on to those things, because I had done my research. I knew the kind of imbalance and just mood type of changing things and weight, all of those. Like, I knew, and I was like, no, there's no way. Is there no other thing? So that's when I think I started, the foundation, because I was like, there must be another woman who is out there suffering, feeling very invalidated, her pain being negated, and the issue almost being, and suffering literally in silence. And for me, it was just to let, just to come to form a community and come together and assure other women, especially the younger girls, because I feel like that at the most formative years, because endometriosis takes on average 7 to 10 years to diagnose. And I'm like, and that's usually at the formative stages for the teens. I'm like, I think the more we talk about it, the more we equip the parents of these young girls and the girls themselves to be able to identify, like, this is not normal, get attention quicker, so that they don't have to suffer with the consequences and the effects that I have had to suffer with. So yeah, like 4 surgeries later, and getting used to theater, and that whole experience of that theater outfit, the one that leaves your butt open, very familiar for me. I'm like, those are normal. So, but I mean, what has ended up happening for me is that I have lost my ovarian reserve completely, that now I am literally on synthetic hormone, so HRT, until my menopausal time, So I don't have that chance to have children naturally, unless it's a God thing, which I don't dismiss completely. But it will mean that I'm going to try much harder than other women, because I think, like, I had my last period, I think February 2020. So just realizing that, one, as a woman, I have the right to actually request for an alternative method of managing the condition, rather than just going in surgically. Because if there are cysts around your ovaries, what women don't know is that when they go in surgically, inevitably they harvest part of your ovaries. And you see, women are never told, and that's why I think, you see, for doctors, they look at you like a thing. They look at you like an object, not even as a human being. So the first response that come out of their mouths is usually, you will not have children. Why? Because they've already calculated 1 + 1. If we do surgery, if we go in, this chick is not. They know what is going to happen. But it's important to walk me through that journey. Help me understand, okay, why? And if I need to, like Tamara, am I considering, I mean, like, is there like, am I married? Do I want to have children? And stuff like that. Is that on the table? So that I understand what the implication of this procedure is going to be on that path. Rather than just, it's alarmist. It's like, you will never have children. So I'm like, so now, there's no use to scare us. There's no point of scaring us.
Exactly.
Help us understand. Just explain.
Just
explain it. So I think for me, those are some of the things which I feel are really lacking, especially in the healthcare, by the healthcare professionals. you know, like even just the sensitivity of like the nurses in schools and stuff like that. Who are women? Sometimes it shocks me how other women respond. Who are in healthcare responding to other women. I'm like, it's fine, but I don't blame you, because if you've never gone through my pain, then you will never be able to understand.
Yeah, and I think one thing that you said that I'd like to pick on is that you shouldn't negate your pain. Like, you see, even everyone has shared the different experiences that they had. Maybe you have endometriosis and it's not at Elsie stage, but don't negate the fact that you're dealing with that condition. So also be able to speak up and speak your truth. And one thing that I think all of you have touched on is also being paired with the right gynecologist. So I think, you know, if it's fine with your gynecologist, we will share their details in the description and their contact, so that, because it's important to see someone who can be able to help you.
Absolutely.
Yeah, and then I'll just define endometriosis before we go to the next question. So it is often described as a painful disorder in which tissue similar to the tissue that normally lines in the inside of your uterus, or the endometrium, grows outside your uterus. So with endometriosis, the tissue can be found either in the ovaries, fallopian tubes, the intestines. I've had some in the stomach, in the lungs. Yeah, and the most common symptoms are pain and menstrual irregularities. Yeah. Then just moving on, would you say, since you've been diagnosed, is it easy for you to have conversations with your friends, your mom, your siblings about your conditions, or is it something that is still difficult? Like, how would you say you're able to talk to people about it?
I think it's become a lot easier. When it came to the fibroids, because I knew my mom had it, it was very easy for me to take it on. And my doctors all along the way were very descriptive about it. I did a bit of the school of YouTube, although mine was Google, because sometimes it's also good to just go and read the facts for yourself. And then with the adenomyosis, it's easy for me to talk about it because generally I'm very open about these things. But now I'm having to explain a lot more because people don't know what it is. You know, so even at work, times I take time off. The HR is like, oh, you got period pain. I'm like, I have period pain, yes, and I would like a day off. That's now, I think, another conversation that needs to be had, especially for young girls going into the workplace. We've normalized period pain as being just, women can handle pain. So if it's period pain, take a Panadol, you'll be fine. So we need to have more open conversations in the workplace, in the schools, because even some of these nurses have grown up in a completely different culture where these things are not discussed. You can't openly say, I have period pain, I need to go, or I need to rest, or I need time out, because then you're looked at as a woman. It's like, then you're not a strong woman, you can't handle this pain. We don't have to normalize being in pain. If you're in pain, you're in pain. I mean, men get man flu all the time, and we give them the sympathy. I know it's not the same, but we really need to normalize the conversation around pain, to sensitize the general population, because as women, there's also men who are guilty of doing the same thing, but it's not because of insensitivity, it's from a lack of knowledge. So you build that information so that people are also sensitive to the issues that women have. And that will also create a lot more conversation around all these different conditions, because these are just 4 that you mentioned,
and there's so many.
And there's so many others that have similar side effects. So, you know, for me, it's been easy to have the conversation, but I believe people need to, you know, have even more of this conversation so that we make it, we normalize it, not make it like, you know, a hat of shame that I'm wearing, that I have a certain condition. Normalize it, have the conversation.
I remember growing up, people used to say, oh, like there's someone who told me that I was told by, they went to a nurse and they said they were having really painful periods, and the nurse said, oh, don't worry, this is practice for labor, you know, or like for childbirth. And then another one told me that, oh, me, I was told if I have painful periods, then my labor will be smooth. So they always tell me, you though you haven't had cramps, wait until you see childbirth. And I don't think we shouldn't normalize, and even just these stories going around pain, like just don't normalize your pain. Like, and also those things that people say jokingly, like, oh, you know, a woman is supposed to, you know, take the pain and manage the pain. And if you think, and I think pain threshold is different for everyone. So if me, I feel like I'm in pain and you don't feel like I'm in pain, I'm entitled to what I feel, and I deserve to be heard.
I think there's need for us to bust those myths, and I think especially just to guard the young girls, because, you know, we grew up resenting our periods, but even on this journey, I think there's need for us to love this journey that we're on, that we are created woman. And this is part of being a woman. Unfortunately, it comes with pain, but it's not necessarily like something to be not loved.
About having these conversations, it's because as many as all these disorders may be, some of them have very similar symptoms. I remember the first time I had the conversation with Lynna, she actually asked me if I have PCOS. And even I said, like, I'd look at it and I'm like, I have PCOS. But when I actually look at the symptoms, even just from Googling, just page one, WebMD, and a lot of the symptoms, the signs seem very similar. So be aware that some of those things might be an underlying issue, but don't directly pinpoint and say, I have PCOS.
Don't self-diagnose. Definitely.
Just know that it's not normal. It might be another issue, so explore it more.
So what are some of the symptoms that you would say you're still experiencing as a result of your condition? So we can start with you, Elsie.
I'm in pain. my wrists and my knees, I experience a lot of joint pain. This is because of the fact that I am perimenopausal. So I've hit menopause before my actual menopause years. And now I'm taking medication, or the hormone therapy that I am on is to help protect me from having a heart attack earlier than, because like heart attacks, I think, come, at when you're older and stuff like that. I think there's something like that. But I now I am more at risk because of those hormones, not being in there and in place. And then the other thing is to just protect my bone density. So I think one of the things, and I'm in a lot of pain right now, I think you guys have seen me crying, is just this, especially when it's this cold. I usually sleep like with hot water bottles on my arms, so that at least I just keep them warm, and just manage the pain. But that's one of it, and I don't have my periods anymore, so that's a relief. I'm so grateful, because in fact I tell people, I'm just like, this feels like a summer day for me, 24/7, 365. Where I'm not experiencing all that pain. I'm no longer on any, strong painkillers. I'm resting well. I'm sleeping better. I think I was diagnosed with depression early last year, but I feel like that was also part of, the whole journey. But now I'm fine. I'm better. I'm off my medication for depression. So I think if I was to ever just describe like everything that happens, it's quite a lot. And like Njeri has shared, the condition mimics other the symptoms mimic other conditions. So it's very easy for me to think, I have PCOS, I have this and this and that and the other. But I think we're emphasizing and saying, girls, make the gynecologist your friend. Like, we forget about GPs. You can go to a GP, you can see any GP, right? But I think one of the things that we don't do very well for ourselves as girls is care for that very intimate part of ourselves that is so critical, that makes it almost links and attaches itself to my identity as a woman. And so I think we need to also just mobilize some resources and just make sure that we are going to see the best gynecologist every 2 months or 3 months, whatever it is, just making sure that you're good.
Because it's like how someone
like
told
servicing
me,
a car.
The same way your car needs to go for service, even if it's not
this needs
for
to be
you,
serviced.
you also need to go for service.
I agree. I love it.
For me, it's, I think, the drama that usually comes with my periods. So the throwing up, because I get very nauseous. That English. Okay, the feeling of nausea. So yes, there's that. Also, the weight gain. Like now, I'm actively working out. Like for the first time, I think I've been consistent for a month now. Actually, as at the end of this week, it's now a month. But
well done.
I am.
It's not easy.
I know, even from having spoken to my gyna and even other people that have consulted with doctors and all, it's not going to be easy. Loss of weight when you have hormonal imbalance, it doesn't come easy, or any hormonal disorder in that matter. It takes
quite a bit. You have to change your nutrition. So that's what I'm trying to do. I remember so I bought a program and it came with like, you know, what you should eat and what not. So the last time I went shopping, I couldn't even believe it. I looked at my cart when I got to the till and I was like, and I have lentils. I was like, Lord, is this what my life is about to be? So there's that, having to balance, and then it manifests a lot on my skin, especially my face. My hormonal acne gets really bad. Fortunately, now there are a lot of people who do a lot of skin-related content. So there's one specific one, Auntie Nemo, who gave me a chart. So the way you use your products, you do it in line with your cycle. So you know at what point you need to be exfoliating, at what point you need to moisturize even more, so that you're kind of one-upping your hormones. You know what to do at what stage of your cycle. So that's also helped quite a bit. Then there's the aspect of mental health. I was diagnosed with well, I don't think you call ADHD. We don't, usually ADHDers don't like calling it a disorder or an illness, just for many reasons. But whenever I'm having my lows, and then when it's also that time of the month when I'm having my periods, they get low. So now it's between therapy, because I go for therapy, and then having to journal, small things just to make your life a bit easier and have an outlet. Because you see also when your hormones are dipping and then you also have a mental illness on that side, it can get very intense all at once. Work-wise, I'm really happy because my line manager also has very sharp pains when it comes to her periods. So there are times where even her she'd call me and she's like, hey, today is not the day, I can't come. Then there are times where in the office and I'm looking at her and I'm like, I gotta go. There's nothing, there's no work. I'm not even looking at the laptop right now. Honestly, for me, I'm just sitting as a post. So she'd let me have the day off, go relax, get a shot, come back when I'm stronger.
For me, PCOS is just, it's fun. It's a funny, not a funny, but it just manifests itself in some weird ways. Anyway, so after I got on the pill, my periods are regularized somewhat. Like, even if they delay, it won't be by too long. So they'll come. Nowadays they'll come. But one of the things, it's just, as she said, the struggle of losing weight. I found that I lost so much more weight than when I was on the pill than now that I'm off the pill. And I'm like, it's like, it's those now bitter sweet things like I had to eat, but I was looking so good. But then now, you can take 3 weeks to lose 1 kg. It's like, what's going on? At that time, you're really trying to eat all the things, but nonetheless, I'm just still working out to just, feel good. But yeah, I don't know if it's just me, but I've read about a lot of other people doing the same. I've been having the same thing, but where you just want to eat carbs. I don't know if it's just me. Every day you just want chips. You have to eat chips there, and it's like you try and
avoid, but
it's like they are calling you. So I really struggle with that. Then another thing is obviously around my period I get super depressive, but it's just like around my period. And then when the period is done, it's like the next day you wake up and you have brand new fast. You're like, what was I feeling? Who was that? I just get super depressive around my periods. Then also mood swings here and there, but I've learned to manage them. As she said, journal, just try looking for an outlet, and sometimes
a healthy coping mechanism.
Grounding yourself and reminding yourself, like, no, calm down. Then this is how we're gonna attack this.
Yeah, thanks for sharing. Because you guys are sharing symptoms and also ways to manage them, like how you're coping with the different symptoms.
Mine, I'd say, are still there. So there's months when I have a full month of every day I have cramps constantly. So I'm on pain medication for an entire month. But I learned that exercise, being active for me also helps. The back pain is on and off. So there's months when I will have no back pain. There's other months when I will literally take 3 days off. So it's all very, very topsy-turvy. It doesn't help that I was diagnosed with hypothyroidism last year. So I have an underactive thyroid. So there was a period where I had symptoms of both. I had insomnia. Those days I would have 3 hours of sleep. Those days I'd be awake for 48 hours. And then coupled onto that, I had weight gain of like 10 kilos, 10 to 15 kilos, just out of nowhere. I hadn't changed anything in my eating pattern, nothing of the sort. But my gyna was, he gave me the options that I had, one of which was hormone therapy. But we have a history of cancer in my family, so anything to do with hormones for me is completely out of the picture. So he says, the best thing to do, manage your exercise, manage your diet as well, keep active, because for me, now that activity also helps to clear the head, it also helps to strengthen my body. So I worked with a personal trainer for about 4-5 months, and in that period I lost about 12 kilos. He also helped me understand the foods better, and even for myself, after going online and seeing what foods would help, I've changed the relationship that I've had with food, because for me it wasn't about the quantities, it was about the quality of what I was eating. So just managing that, and then something all of us Kenyans like, which is alcohol as well. Alcohol is actually an inflammatory trigger. I'll tell you for free, if I have a glass of wine last night, this morning I will wake up and I'll have cramps, I'll be in pain. So even that has helped. So all these are mostly lifestyle changes for me that have helped me feel a lot better. I have painkillers. I still walk around with I call it a pharmacy. I literally have a bag full of painkillers, but I take them a lot less. And even with the weight loss and the changing of the diet, my period is also a bit more balanced. So I used to have periods for up to 8 days. Now my period is like clockwork, 28-day cycle, and in 4 days I'm done. And that's because of those small lifestyle changes. So the pain won't go away. I know that for a fact. Neither will the backache. But I will just have to make a conscious decision to manage my lifestyle so that it's bearable in the long run.
I think something all of you have touched on is one, working out, your relationship with food, also taking care of your mental health. So therapy, journaling, and it's not just people who are dealing with different hormonal or different conditions, because everyone during your menstrual cycle, your hormones drop. So even like if your periods are normal, there's sometimes where you have, the blues.
Sad.
You just feel sad. So just now make it like an active practice. Just take care of your mental health, throughout your cycle.
One other thing I wanted to add is having a good support network.
That's true.
You can't handle this thing on your own.
That's true.
So the people that are the closest to you, have a talk with them about what you're going through, so that they can also understand, and they can also be there to help you and to just make your life easier. And women shouldn't shy away from talking to their partners about this. Please don't shy away. So it's very important to establish and have a close circle of a support system around you as well.
So if you talk to your partners, it can start with a small thing like, send them to the shop for pads. That's how you can warm up the conversation. So the next question is, what do you think medical professionals or even society needs to improve on to make it easier for women to speak out and to seek help? For me, I think I was watching a video. So the lady said that you need to put the U back in uterus. So one of the things that we find is that, women are not taken seriously when they complain about their pain. But we need to remind people that you're the you. Like, there's uterus and then there's also you. So if I tell you I'm in pain, also believe that I'm in pain and don't ask me to justify my pain.
I think that really quite captures it well. It's not making someone second guess the fact that they're actually in pain or dismiss their pain. I say pain is not visible for as long as you don't have an external like injury. Like if it's not here, if you don't have a cut here, you're not gonna see. Like, of course you'll be able to tell, like if there's a cut here, you'll be able to tell, okay, this is a cut here, this is the scale of pain. But you see, the pain that we go through is invisible. And because it is not visible, that is the reason why it is minimized. But also understanding the history of how women and their pain, especially around the period pain, was actually dismissed, is that for a very long time it was linked, it was defined as hysteria.
Yeah.
So we're psycho. That's why a lot of doctors, like you'll hear a lot of women talking about the fact that they were being told they're mad, they're imagining, and stuff like that, right? And then there was something else that I discovered. And guys read a lot, but that's a story for another day. The stuff that I read was that for the doctors to actually understand a woman's and to come up with a solution for our pain, they used a male body. And I was just like, really? Like, how do you use a male body to try and understand the female anatomy? Like, and even finding so anyway, I think that needs to be changed. So thinking about the woman as a woman, finding out her problems for her specifically, it's not like diabetes. So I like to use this example a lot. It's not like diabetes, where like, for example, every morning you'd have to wake up and you have your insulin shot. It's not standard care for all of us. It's very different. And I think that has to be led by the doctors themselves. So they stop approaching us like, as a group, as a cohort. Yes, of course, the issue affects a group of women, but how you address their pain for each one of them is very individualized. So there has to be individualized care. There has to be believe their pain. Do not dismiss that pain. Do not make it seem like they're imagining. And just take your time. I think the doctors should also take their time. They shouldn't keep us in the waiting rooms for like 3 hours and we only can sit with them for like 10 minutes. And they just want us to talk and finish and go. No, I think that has to be changed. So, I mean, of course, without belaboring the issue, I think for me it's important that women who do not suffer with these conditions don't become part of the ammunitions, don't become part of the weaponry that is harming or hurting the women who are actually going through this. Instead, support them, and then don't generalize it like, women are supposed to have. Don't use yourself, the women who are normal, don't use yourself as a standard to say that this is how periods should be. No. Every woman is having their own unique experience, and I think that needs to be validated as we go along. And I think I encourage also women who are like us, who are suffering, educate and empower those who are around you, because that's you are their only canvas right now, so they will only learn from you, so that they can also be able to now share the same information with someone else. If they see another woman struggling, they're able to call it out and say, I think you need to seek medical attention. Not Google.
Yes.
Not WebMD.
Not WebMD. Not WebMD. But yeah, my thoughts.
Okay. Yeah, so just as we wrap up, any parting shots you'd like to share with the women who are watching? So like the same way you said, the women who are normal, or the women who are going through it, or even just young girls who are about to start menstruating. Yeah, just anything that you'd like to share with them.
Normalize your period. Your period is normal, but don't normalize pain. It's part of being a woman, but never let anybody tell you, pain is normal. Don't. And I feel like that's the first step into acknowledging these issues that women have.
For me, what I'd say is just when you get to gynecology selection age, choose your gyna well personally. Pick someone who takes their time, or at least maybe ask the one who you've gone to see to take their time with you. Force them to explain to you, even if there's 30 people waiting outside the door. Make yourself heard and understood. By the time you're leaving the session, you know exactly what is A from B from C.
When someone dealing with such a condition is talking to you, listen. Don't be quick to give your inputs, your diagnosis that are from nowhere. Sorry.
Yeah.
But still,
No.
don't just be still, be calm, listen to what you're being told. Sometimes the feedback or the response that the person is waiting for is not necessarily your comment. Like you've had it, sometimes these things take a toll on your mental health. You just want someone to be present. So calm down. For the individual, be very attentive to your body. For the longest time when these symptoms started coming up, especially in high school, because I was in school for the longest time, I need to come and remember what I need to tell the guy now by the time I'm coming home. So I had a little notebook, and this is especially for the younger girls. Take note. If you see something off, take note and say, okay, on day 2 of my period, the clots were like this. So usually by the time I'd get home and I'm going now for my appointment, I'd go and I'd be like, hey, Dr. So on this day it was like this, then on this other day like that it was like this. This was, I found it a bit awkward. Here, look, have a look at it. And even like your cycle, the number of days, so this time it was 28, the next time it was 40. Those are the things that also help them to give you a proper diagnosis.
Okay, so I think we need to have policies that protect the women in the workplace. And where I'm coming from is we have 14 days, I think, of sick leave that, according by the law, I mean, we're entitled to. But the women like us who suffer with these conditions, usually those 14 days will have expired, I think, even by the 3rd month of the year. And so I saw an example of a company that has provided additional days of paid leave for women who are in their menstruating years. And even I think a country like Zambia has given women, all women who are in their reproductive years and still having their menstruation, 2 days of leave every month. I mean, and this is Zambia, guys, and we're in Kenya, okay? I just feel like, you know, we need to just make sure that some of these things are happening.
So I think, okay, basically what I've gathered, or what my takeaway from the advice you've shared is, 1, to be empathetic with other people, because I'm, you know, I would say a normal menstruator. 2 is to normalize the conversations. Also, as someone who has a normal period, I need to create a space, or like a safe space for you to be, because it's not an easy conversation. So I need to create a space where you can be able to have a conversation with me. And the 3rd thing is educate yourself, you know? Like if you've had this thing called, hey, that one I had is called amenorrhea. Okay, let me go and Google it and read a little bit about it, so I'm just not as green. And as we wrap up, I'd just like to say thank you to each and every one of you for coming, for lending your voices to this important conversation, for trusting us enough to share with us your experience. And yeah, we continue saluting you for your bravery, and we just hope that, you know, your experiences get much better. And yeah, that's it from us. It's been a heavy episode, but I think it was very necessary. So yeah, catch us next time. Bye.
Bye.